Hi,
Angelica,
Dr. Bhargava. How are
hi,
you?
I am good. How are you doing? I'm excited
I'm
about
doing well.
this chat.
It is going to be very exciting. I know that Dr. Crawford is going to bring a great perspective and great case studies to discuss, so I'm excited.
Me too. Me too. And we'll also be having the Ewer brothers, Chris, and Eric. And they worked on the documentary Hiding in Plain Sight, the Ken Burns documentary on youth mental health. So very excited about their perspective and their travels and meeting, a lot of kids with who are very brave and courageous kids who spoke about their own mental health struggles. So excited about hearing from them as well.
Hi, Dr. Crawford. How are you?
Good. How you doing?
Doing well, thank you. We're just about to get started shortly, so if everyone can grab your coffee, some water, we will get started at the top of the hour. Hi, Chris. Hi, Eric. How are you?
I'm well. How are you?
Doing well. Thank you for joining us today.
Oh, my pleasure.
We have Dr. Bhargava and Dr. Crawford on. We'll get started in about a minute or two, just getting everyone settled in. If they want to grab coffee or water, we'll get started shortly.
Hi, Chris. Hi, Eric. Hi, Christine. Good to talk to you guys again.
Good to talk to you.
Hello.
Where are you all calling in from?
I'm calling from New Hampshire.
And I'm calling in from Connecticut.
Wonderful. And Christine?
I'm over here in Boston, so we have a whole New England country over here.
Well, now I feel outnumbered. That's great. Well, thank you so much for joining us.
Oh, it's our pleasure.
I think we'll get started now. We have everyone on board, and as people come on in, hello, everyone. I'm Angelica from Medscape Education. We are hosting a youth mental health discussion on today's Twitter space, and I will give it to Dr. Bhargava.
Thank you so much, Angelica. This is Dr. Hansa Bhargava. I'm Chief Medical Officer at Medscape Education, and I'll tell you, I'm a pediatrician, and I am very, very interested in this topic. One, because I am a pediatrician, and I've been seeing this for a number of years, the youth mental health crisis, but also because we have some great experts here today with us. First of all, Dr. Christine Crawford from NAMI, and I'll let them all introduce themselves in a second. And then we have the Ewers brothers who worked on the Ken Burns documentary, Hiding in Plain Sight, Youth Mental Illness. So thank you all for being here and spending the time to talk about this really, really important issue.
Thank you.
Thanks for having us.
So, Dr. Crawford, and is it okay if I call you Christine for this?
Absolutely. We're friends
Okay.
here.
Okay, please call me Hansa. So, I will start with you. So, first of all, if you don't mind letting the audience know your background, and then I will just launch the question at you. Tell us what is going on in terms of youth mental health.
Yeah, so thanks so much for having me. I'm a child and adolescent psychiatrist based out of Boston, and I see kids and teenagers in our outpatient psychiatry clinic here at Boston Medical Center. And also, I'm the Associate Medical Director for the National Alliance on Mental Illness, also known as NAMI, which is the largest grassroots organization that's out there for mental health. So, Hansa, let me tell you what it is that I've been seeing in clinic day in and day out. Over the last couple of years, we've been seeing more kids talk about symptoms of depression and anxiety, as well as trauma-related symptoms. And when these kids share with me their problems, their worries, and their fears, they're not always using the language that we use as psychiatrists or as health professionals when it comes to mental health. They're talking about being stressed and overwhelmed and not being able to connect with others and feeling alone. And these are all markers and indication that something is going on. And I just want folks to know that this isn't something that we've only been seeing over the last couple of years in terms of young people experiencing significant mental health symptoms. This has been going on for quite some time, but because of the events over the last couple of years, we just could not ignore the mental health and how the mental health of our youth have been deteriorating over recent years.
Yeah, and it's such a problem. And unfortunately, it's what you said, like even before the pandemic, we saw these numbers on the rise, and then the pandemic happened. And, I believe that it probably catalyzed a lot of these issues with, unfortunately, the social isolation and the cancellation of a lot of these activities. So let me ask you, like, do you think, Christine, that the trends are, is it the same trajectory that we're seeing, or do you think because of the increased awareness, that things might have changed?
I think it might be both of those things happening at the same time. I think that over the last couple of years, there's been a sharp decline in mental health of our youth. We've seen upwards of 30% increase in symptoms of anxiety and depression over the last couple of years, and that number continues to grow. And I think that a lot of it has to do with not only the pandemic, but also just recent life events that have been happening, and it seems like it's one thing after the other, whether it be back in the summer of 2020 with the Black Lives Matters protest, or whether that be even as recently as, earlier on this year with Ukraine, and even with some school shootings that we've been hearing about. It's one thing after the other. And when you're already experiencing some sadness, feeling hopeless about the future, unfortunately, these events can reinforce those internal feelings that you're experiencing. And when you're a young person, when you're a kid or a teenager, your brain is still trying to figure out how to process these emotions, what they mean for you, and you're still trying to build up your toolbox of different tools and strategies and resources that you can use in the moment to be able to cope. And so, if you're experiencing this and you don't have the tools, and your brain doesn't have all of the reserves that it needs in order to figure this thing out, it can all lead to this crisis that we're seeing right now.
Yeah, it's just so unfortunate. There's just so many elements that have contributed to this, and so many kids who are suffering. I'm going to turn to Chris and Erik here for a minute as they worked on the film. And Chris, let me start with you. As you were working at, you had the opportunity to meet some of these kids, right, who are incredibly courageous to come forth. Was there anything that struck you about these kids as you filmed the documentary?
It's a great question, Hansa, and again, thank you for having us on. Um, yeah, I think that immediately what struck me was the fact that I could identify, I could recognize some part of myself in every single one of their stories. There's an overriding sense of relatability once you start that happens when we start being open and honest with one another and with ourselves about our mental health struggles. I mean, we have statistics that say, 1 in 3 or 1 in 4 or whatever it is, and those statistics are utterly misleading and in my personal opinion completely useless, because until we start to look at our mental health on this with parity, with equality on the same level as our physical health, that sense of community, that camaraderie is the wrong word, but that relatability will never exist. I mean, there's not a single one of us that hasn't struggled mentally with our mental health, and on a spectrum, some scale, whether it be sadness to depression, or nervousness to anxiety, or whatever it happens to be. So I think that when we were interviewing these kids, it astonished me that across the board, regardless of the symptom, the severity, thought or mood. I recognize the part of me and my story in my life, and even more importantly, a part of my family's life, and most importantly, my daughter's life. The experience of working with these incredible individuals has brought about immense change in my life, my nuclear family life, and in my wife and I's ability to 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 appropriately address our daughter's mental health struggles.
Yeah, it's not interesting, right? Like it's common ground. You're saying there's like common thread that connects us all, right? And it doesn't matter really about the backgrounds or the ages or whatever else. Like we're all kind of like we all have to kind of deal with it, and it's really really important to be aware of it so that we can learn how to deal with it, not just as people, not just as kids or youth, but as parents. Eric,
Yeah.
you told me a story about your own youth. If you don't mind sharing that, or if you want, you could please tell me a story about any of the people that you interfaced with as you filmed this documentary.
Well, I think that my story, like Chris was referring to, I saw in a lot of the youth that are in our film. So by telling my story, in some ways, I'm telling their story. It's kind of one and the same to me. Um, when you're a child, you really don't know that something's wrong. You kind of don't have that context to understand your life versus other people's lives. So you consider your life quote unquote normal. This is who I am, and this is my family, and this is my dynamic. Um, my parents realized, they were well intentioned. They realized early on that something was off with the way I dealt with conflict, the way I dealt with myself, and I started assuming guilt for everything. So they sent me to a psychiatrist in the 70s, which I'm assuming was pretty unheard of, or at least if it was happening, no one would want to talk about it. My son's going to a psychiatrist, but I went for 4 or 5 years. And while I do believe there were some positive effects that came out of it for me, unfortunately, when I stopped going in my preteens, probably around 12 or 13, I went back to the same family I had before. And what does that mean? It means that I fell back into the same kind of patterns and habits and symptoms that I was having prior to the psychiatrist. And I've carried those all the way to the present. And the remarkable thing about relatability, especially when you're older and you have that ability to look back, I realized through listening to these young people, I saw my own struggle. I also saw with clarity what I needed to do about it. And I needed to act, and I did. And my life has changed because of it.
That's amazing, Eric, and kudos to your parents for actually going to psychiatrist and seeking help at that time. And it wasn't something that was really out there. And so on that point, Christine, I want to ask you, like, do you think that now that it is out there and there is awareness, and some of it thanks to people like the Ewers brothers and Ken Burns who have done the documentary, but also for all the efforts of yourself and everyone else, does that actually make a difference in terms of helping to diagnose and intervene?
I absolutely think it's made a world of a difference because we're talking about mental health. For many years, for many decades, it wasn't a conversation that one would have publicly and openly, and they wouldn't have it with their friends and their family members. But now it's a conversation that we just cannot ignore. And to have an amazing documentary like Hiding in Plain Sight, it really just highlights the fact that there are so many young people and families that are left kind of grappling with some of these issues around mental health and they're dealing with it. But it's important for everyone to know that you are not the only one who's going through it. You're not the only family that's going through it, even though it may feel like that in the moment. So I think by these documentaries, by talking about it, by having a discussion like this, it raises awareness that mental health touches everyone's lives. For so long, when we think about health, we would only think about your physical well being. And when you would bring your kid to see the pediatrician, there would be this focus on the child's physical well being. But I've really been encouraged by this shift in recent years for primary care providers to touch base with the caregivers about how their kids are actually doing from a mental health standpoint. And the more and more that we integrate mental health related topics in our everyday conversations, that's just going to make it easier for kids to step forward and say, look, I've been feeling really anxious. I've been experiencing depression. And for the family members to know what to do with that, to know that they can talk to their pediatrician, that they can pick up the phone and schedule an appointment with the therapist, or even talk to the school about any emotional related issues. My hope is that these conversations will reduce the barriers and the hesitancy around seeking out help and treatment.
You still there, Christine? Christine?
Yes, I am.
Okay, sorry, we're having some tech issues.
Sorry.
No, I think you make a great point. So let me turn back to Chris and Erik, and would love both of your thoughts on this. Chris, what do you like for the future? And I know that this is a really important issue to you and Erik, and I understand that you are thinking about potentially doing a second film. I don't know if I'm supposed to say that or not, so I apologize if I spoke too soon.
Not
But
at all.
Would love your thoughts on what else is really important to raise awareness about in this subject area from both and Erik.
Yeah, I think, I mean, it's such an important question. Thank you for asking. We realized at the start of Hiding in Plain Sight that we couldn't make a film about the specifics of mental health care system, because we don't yet unanimously acknowledge that mental health care is as crucial as physical, right? I mean, we can't talk about best practices, and where our failures were and treatment and all these other things if we can't collectively agree that this is even an issue, like
Yeah.
and acknowledge that, so the first film, Hiding in Plain Sight, was right from the get-go intended to be about the experience. It was about creating relatability. It was about normalizing through talking about it, and in the hopes that the same thing happened for me and for Erik, will happen for every viewer, regardless of their preconceived notions, about mental illness. Hopefully we were successful there, and as Erik mentioned, I mean, it continues, to be viewed. It's a mission to us. It was not just a film that broadcast and premiered and then we move on to the next. But this has a long, hopefully a very long tail. But we have already, or almost already, begun on the second film, the second of the series, which will beg those questions, which will focus a light on the system, or the lack of a fully functioning system. We will talk about advocacy, policy, treatment, pharmacology, and we will do so through the lens of adult mental health challenges. We focused on the children for the first film because, as we all know, the vast majority of mental health challenges onset before the age of 25, and the kids, our youth, are typically dismissed, or their thoughts and feelings diminished. We discount, so we wanted to make sure that we created that foundation awareness of understanding, before we headed into sort of some bolts discussion. And we think that that following the same structure, except again through the lens of adult mental health challenges, will be just as effective. I mean, we can use our collective experiences now in our middle age with children, potentially with grandchildren, and use that as a vehicle for the discussion on what is working and what is not, and hopefully we can continue to sort of push the needle forward.
Yeah, no, absolutely, Chris. And it's so great that you guys are looking at this, because there's so many other areas to raise awareness about. And certainly, as you pointed out, we do have a malfunctioning system. I'm going to get to Christine in a second to ask more about that. But before I do, Erik, you and I had a conversation about this, I think, a while back. And we talked a little bit about access to care, and also the parents and how the parents are feeling. Are these areas that you will be also focused on in the upcoming film?
Yes. It's access. We all know, if anyone who's listening, who's tried to pursue getting professional help for their mental health challenges, I'm sure every single one of them to some degree has hit an obstacle. I believe, from what we've heard and what we've witnessed and observed, it's most of the time, and it's usually not a small obstacle. It's usually, I want help, but there's no one available. And then there's no one available who will take my insurance. And the kind of connection that you need with a therapist sometimes isn't the right one, and you have to keep searching to find that right fit. Um, Parents and family therapy, I think, is probably one of the most critical elements of the path to wellness as a nation. And Dr. Sarah Vincent said it best in the film. She says, family therapy, and she says, it's so hard to get. It's so hard to find. It is so critical. I am, if you will, a victim of not having that opportunity to have my family, my parents especially, introduced into the therapy sessions that I was going through, because I do think it could have changed the trajectory for not only me, but for them and their own mental health struggles, which neither of them, honestly, um, want to accept. And just piggybacking real quickly on Chris, that we've only told half the story. That's our fundamental philosophy. Teens and young people are just half the story. And just giving one example, we've heard in statistics lately that the number one cause of adolescent or youth death is suicide, either number one or number two. But a lot of people don't know that the suicide rate is actually highest in our senior citizen population. We have so much more to do as filmmakers. We have to complete that other half of the story.
Yeah, I totally agree. And that is, I'm so glad that you actually, I think the geriatric population is certainly suffering. It's something that we absolutely need to raise awareness about. Vivek Murthy was talking about the loneliness epidemic even prior to COVID, right? And this is, it is, mental health and all of those age groups are so important. And thank you, Erik, for bringing that up. I think it's a key issue. Christine, I'm going to turn back to you for a second here and ask you about this issue now that we are aware of it. Now, hopefully that, kids will get and people will get an earlier diagnosis. Part of that is access to care. I mean, what are your thoughts about how we can improve the system? I mean, do you think, for example, that these innovations, whether it's telemedicine or FDA approved apps or any of that, actually will have a role to play in increasing access?
Yeah, I really do think so. And I think that the presence of telemedicine, what's been so good is that there are people who reside in communities in which there is not a child psychiatrist for many,
Yes.
many miles,
Yeah.
And we know that there are only 8,300 child psychiatrists in the entire country. And there are a number of places in which people have to wait many, many months in order to be able to bring their child in to receive an evaluation so that they have an understanding of what's going on with their child and what help and supports need to be put in place for that kid. And so telemedicine has been a game changer, especially given the fact that insurance plans are now reimbursing for telemedicine visit, and they were basically forced to do so because of the pandemic, and we weren't able to see people in person. I think some of the apps that are available, it's just a tool that can help people better understand what their symptoms are all about and be able to use some of the language that we use in mental health to describe their constellation of symptoms, to know that if they're having problems sleeping, they've lost interest in certain activities, they can't concentrate, that perhaps all of those symptoms together could be consistent with the presentation of depression. And sometimes just having a better understanding about the health conditions, about the symptoms, can really be empowering because that can provide a language that families and kids can use to communicate their distress. Now, the reality is that getting help immediately is not available for everyone. And unfortunately, there are a number of providers who have practices that are cash only, in which, if you do want to have your kid seen relatively quick and you're able to pay $300, you can do that. But then that leads to an equity issue.
Yep.
And so we really need to figure out how we can improve the system so that reimbursement rates are adequate to ensure that we not only have enough psychiatrists, but also other staff, such as social workers, licensed mental health counselors. There are so many other disciplines that are part of psychiatric care. And we all need to work together to try to make it such that we have more robust services in place so that when people need to access them, they can. And the last thing that I'll say is that people need to utilize their primary care providers.
Yep.
Talk to your pediatrician about what is going on, because oftentimes there may be treatments that the pediatrician can initiate from that visit, and you can use them as a bridge until you're able to provide more well-established psychiatric support.
I love that. Thank you for saying that, Christine. It's so very true. Primary care providers can be a starting point, and they should be a starting point. There needs to be a centerpiece for care as a bridge, and also to provide the care until you can see the other experts. So thank you for saying that. We are almost out of time, so I'm just going to go around the circle and just ask you, what do you want to see changed in the future? And also, Erik and Chris, if you could let everyone know which is the easiest way to find your documentary. Start with you, Erik.
Okay. What would I like to see changed? I think that's a better question for a professional, but I think on the level of being a film director, I would say that stigma is put in our rear view mirror farther and farther behind. That the simple common sense awareness that like having a flu or having a broken leg or having diabetes, you go and you get help for your physical ailment. Your brain is an organ. And the way you think and feel should be treated no differently. So I think stigma would be my answer. And we are very happy that PBS is going to rebroadcast the film in September and make it available for free streaming at pbs.org, and it is also on Amazon Prime, both
Wonderful.
of which you just need to search for, hiding in plain sight.
Wonderful. And thank you for underlining the issue about stigma. And I absolutely agree with you. We could talk about that for a long time. Chris, what would you see in the future?
Oh my goodness.
If you can wave the one, but you only get one thing.
Oh no, I know exactly what it is. I think that through our own experiences that I know are so similar. It's the norm rather than the exception. The reimbursement and the insurance, the parity between mental and physical health needs to end. It needs to change dramatically. It needs to be overturned. I mean, Patrick Kennedy has been trying to do this for a very long time, but there is, I mean, speaking from our own experiences with our 9-year-old daughter,
Improve the system so that reimbursement rates are adequate to ensure that we not only have enough psychiatrists, but also other staff, such as social workers, licensed mental health counselors. There are so many other disciplines that are part of psychiatric care. And we all need to work together to try to make it such that we have more robust services in place so that when people need to access them, they can. And the last thing that I'll say is that people need to utilize their primary care providers.
Yep.
Talk to your pediatrician about what is going on, because oftentimes there may be treatments that the pediatrician can initiate from that visit, and you can use them as a bridge until you're able to provide more established psychiatric support.
I love that. Thank you for saying that, Christine. It's so very true. Primary care providers can be a starting point, and they should be a starting point. There needs to be a centerpiece for care as a bridge, and also to provide the care until you can see the other experts. So thank you for saying that. We are almost out of time, so I'm just going to go around the circle and just ask you, what do you want to see changed in the future? And also, Erik and Chris, if you could let everyone know which is the easiest way to find your documentary. Start with you, Erik.
Okay. What would I like to see changed? I think that's a better question for a professional, but I think on the level of being a film director, I would say that stigma is put in our rear view mirror farther and farther behind. That the simple common sense awareness that like having a flu or having a broken leg or having diabetes. You go and you get help for your physical ailment. Your brain is an organ. And the way you think and feel should be treated no differently. So I think stigma would be my answer. And we are very happy that PBS is going to rebroadcast the film in September and make it available for free streaming at pbs.org. And it is also on Amazon Prime, both
Wonderful.
of which you just need to search for, hiding in plain sight.
Wonderful. And thank you for underlining the issue about stigma. And I absolutely agree with you. We could talk about that for a long time. Chris, what would you see in the future?
Oh my goodness.
If you could wave the one, but you only get one thing.
Oh no, I know exactly what it is. I think that through our own experiences that I know are so similar. It's the norm rather than the exception. The reimbursement and the insurance, the parity between mental and physical health needs to end. It needs to change dramatically. It needs to be overturned. I mean, Patrick Kennedy has been trying to do this for a very long time, but there is, I mean, speaking from our own experiences with our 9-year-old daughter, who had side ideation at the age of 4, trying to find, and we live in Fairfield County, Connecticut. This is definitely not a care desert. Trying to find a pediatric psychiatrist that took insurance was an impossibility. There are zero, and they're forced into this because insurance won't reimburse them for the expertise that they have and the help that they can give. We were unbelievably fortunate enough to pay out of pocket, but as you said, Christine, the equity issue is abysmal.